This week, the mayor of Thunder Bay declared a state of emergency specific to health and social services, in part due to ongoing COVID-19 outbreaks at the city's correctional facilities. City leaders are concerned about the impact the pandemic is having on the vulnerable population and people who are homeless or using community shelters. It's asking for immediate help from the Ontario government. The city wants more funding and staff so it can expand capacity at the isolation centre for people who may have COVID-19 or be at a high-risk contact but have nowhere else to go. Dr. Janet DeMille is the medical officer of health for the Thunder Bay district. She is part of the municipal group which decided this declaration was needed now. And she joins us this morning. Dr. DeMille, good morning.
Good morning, Amy.
So I understand there would have been a series of meetings of officials leading up to this declaration of a state of emergency that you would have been part of. Yep. How would you describe those meetings? What was the tone like?
You know what, I think universally people were quite concerned. I brought forward what my concerns were with respect to the outbreaks that we're seeing at the correctional facilities, but also the impact that we were seeing it happen, or that the impact and what was happening in the, in the sort of homeless and the shelter population. And, I think people really recognize that would be very significant in the potential consequences. There's been a working group ever since the beginning of the pandemic, a working group of really key partners who have put together that isolation shelter, and it's been very fundamental in our management of COVID in the population and protecting individuals and, having a place for people to go. So, this has been ongoing, and certainly we were trying to avoid what we're maybe starting to see right now. But, so basically people were very responsive.
What are your concerns about what the consequences could be of an outbreak among the vulnerable populations in the city?
There's a number of issues that can make that really challenging. I mean, first of all, it can be hard to pick up when an outbreak is actually happening because this is not necessarily a group that will come forward a lot for testing, or they may not even have easy access to testing, although there's a lot of processes in place to be able to support that. But they might be reluctant to come forward as well. And so that's, one big thing is, an outbreak could be happening and we're not aware of it. And similar, these individuals often have very significant needs, complex needs, that can make it challenging for them and for us if they were to have COVID and to be able to take all the measures, of course, to try to prevent the spread. So, really need a lot of support to sort of manage through that.
And there was an exposure at Shelter House last week. When that case was found, what happened? How can you break down what your response was like?
Yeah. So, I mean, we've had a number of different exposures since the beginning of January within that population that have occurred in different spaces. And, we do our usual, right? We follow up with any individual who has COVID. We get information from them, where they were, what they were doing, how they're doing. Of course, we want to support them if they're not doing very well. And then we trace back to, okay, where were they? And if they were in a shelter, like let's say Shelter House, then we would follow up with Shelter House, and we can get bed lists, we can get who was there on the particular time or when that individual might have been there, and then we can follow up. And then of course we would identify anybody who might have been a high risk contact, so more likely to have been infected, and those who are at low risk. But it is difficult to get that sort of level of detail. I mean, when we have to find individuals, and it often takes several connections with them to get the kind of information, and then do the follow-up. And so we take a bit of a broader approach. So with some of the more recent exposures, we've actually done more broad-based testing. So not, just tested everybody in a sense, to really try to pick up somebody, who might have COVID.
Mm-hmm. And then if I'm understanding, so some people would be sent to the isolation center that we've been hearing about. Yeah. Can you tell me more about that center and what its capacity is like and how busy it's been?
Yeah. So it's, as I said, it's been in existence since last year, and, anybody who has symptoms who needed testing would be sent in the past year, to the isolation shelter. They could stay there. They could have a test there, and they could stay there in the test result. And if it's negative, they can be released because they would be deemed sort of no risk. But when we have cases of COVID, when we identify somebody with COVID or anybody who's a high-risk contact who would generally have to isolate up to 14 days, we were sending them to the isolation shelter. So the isolation shelter, and I don't know exactly what its capacity is. I'm not sort of at that level of detail, but over the past couple of weeks, we literally filled it up in terms of with the case and contact management we were doing. So sometime late last week, it was essentially full and needing to sort of manage that. And the shelter is run by, it's really a coordinated effort by many partners. The staffing is often from the shelters themselves. It's separate staff who just work at the isolation shelter. It's supported by St. Joe's, the GAPS team. We're there. The community paramedics are also there. So a lot of different supports to be able to assist those individuals who are there and to sort of work with them over the time that they need to be isolated. But certainly if we were looking for at broader spread or broader number of exposures where there's more high-risk contacts, where there's more individuals with COVID, we would need a lot more room than the current shelter can accommodate.
So the city is asking for help from the province for more resources. From the health unit perspective, where would you like to put more resources right now? How would you use it if we do get that help?
Well, I think really the expansion of the isolation shelter, and that's not only the space but the staffing, and individuals have fairly high needs. So really being able to provide that support while they're in isolation, that will help keep them in isolation. I think another area is to really support the jail in bringing these that outbreak under the control. Really, both outbreaks. That's a very challenging environment to operate in and to control an outbreak, but certainly, keep, whether they need more capacity to be able to do that. That's always a challenge, right? Capacity everywhere, and being able to bring those under control as well.
And when people are released from the correctional facilities, how often are they sent to the isolation center, and would you be part of making that decision?
Yeah, so we're definitely trying to work with both facilities to make sure when somebody is released that we can follow up with them. In both facilities at the present time, there's ongoing testing being done, both of staff and of inmates, so that we can monitor what's happening there. But when somebody is released, and they can be released, especially from the jail at any time, sort of unexpectedly, that's just the way the system works, and somebody who has COVID could be released, or who's a high-risk contact, or maybe incubating COVID but hasn't presented with that illness yet. So we really do want to be in touch with them. And we do have a process with the jail to be able to know when somebody is being released, but it really depends on where they're going, whether we can actually get in touch with them when we need to. So that has been a bit of a challenge in terms of finding people and moving forward with what we need to do, promptly, and that's been a challenge. But that's sort of ongoing work that we're doing.
The state of emergency declaration, that opens the door for more help from the province, as we discussed. But what do you think the message is that the broader community needs to take from this declaration? Well, it is, this is, COVID, this is a serious situation. And like COVID has been since we had it, and it's not over, and we all have to take the precautions. It can happen everywhere. COVID is tricky. I've said this. It can happen anywhere, and it can spread quickly. So it's really up to all of us to keep it under control in our area. And, unfortunately, when we have it there are challenging outbreaks that can certainly happen. We've already seen that, and this is just another setting that we have that. So, to hang in there, we will get through this, but please take all of those measures so we don't see rising numbers in various different places in the health unit. Dr. DeMille, I really appreciate your time this morning. Thank you so much for joining us. Thank you very much, Amy. Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District Health Unit.